Hi everybody, my name is Julie Boyer and I'm obviously a student nurse practitioner, and I am located in Bakersfield, California. For the last 2 rotations, I've been very lucky to have been with an excellent nurse practitioner and a doctor in the internal medicine and family practice setting here in Bakersfield. Originally, my first clinical rotation was canceled because of COVID, and I had to do some of the video simulation, which wasn't bad. I actually learned a lot from it, but it's definitely better to be hands-on. I've noticed in the last 16 weeks, we're definitely seeing a lot more patients coming into the clinic. The first couple of weeks, almost everything was exclusively telephone, and it was very difficult to learn from that. It's much easier getting to sit across from a patient. The clinical rotation that I have been in has been, like I said, family medicine and internal medicine, and many of the patients have been with my nurse practitioner for the entire 15 years that she's been a nurse practitioner. They follow her as she's transferred from one location to another. This is her 3rd location that she's been in for 15 years. My own clinical experience with chronic conditions, I've been an obstetric and OBGYN nurse for the last 20 years. And so I've helped case manage our pregnant patients or GYN patients with their chronic conditions, such as gestational diabetes, ovarian cancer, every different kind of GYN cancer. So in that, I have had some experience. But as far as medical surgical goes, this is my Achilles heel. This is something I've had to work very hard at during my time at United States University. Being in a subspecialty definitely limits your far-reaching access of knowledge base. So I've had to work really hard to learn a lot about cardiac and pulmonary, and I've integrated it into the information that I knew already. The ideal practice setting for me after I graduate would be to get a job here locally in hopefully internal medicine. I've really enjoyed my internal medicine rotation, and I find that one of the hardest things is patient non-compliance, honestly. If patients would just take their meds, they would find that they would be a lot better off, but half the battle, I feel like, after you diagnose them is just getting them to take their medications. Also, I think one of the hardest things is combining subspecialties to all agree on one plan of action for the patient. Many times it seems that every subspecialty ends up prescribing medications that either cancel out or contribute to symptoms that the patient already has. So that's one of the biggest hurdles I see in internal medicine, is just developing one plan that works best for the patient. Anyhow, I'm looking very forward to graduating in 16 weeks, and I can't wait to meet everybody. Have a great term.